we've experienced a slow and steady rise in daily new cases of COVID-19, and Ontarians should expect to see a continued increase as we enter the fall. This is not a cause for panic. Our case rates will fluctuate over time, and we can anticipate that they'll continue to go up. But it is our collective responsibility to avoid a sudden acceleration in cases by getting fully immunized. It is never too late to be immunized. The province's vaccine rollout, which has resulted in one of the highest vaccination rates in the world, is having an impact and is protecting Ontario against more severe cases of COVID-19, hospitalizations, and death. Already, 81% of Ontarians aged 12 and over have received their first dose of a COVID-19 vaccine, and we are around 3% away from meeting our second dose target of 75%. We've almost administered 20 million doses in Ontario. As our rollout continues to edge forward, we need those who remain unvaccinated to step up. Our most recent data shows that people who are unvaccinated are approximately 8 times more likely to get infected with COVID-19 compared to fully vaccinated individuals. Unvaccinated adults 60 years of age and older are approximately 15 times more likely to be hospitalized due to COVID-19 compared to those fully vaccinated. So if you haven't rolled up your sleeve to get your shot, now is the time as we head into the fall. This is especially critical for our college, our university-age Ontarians, anyone aged 20 to 39 years of age, who have lower rates of vaccination and account for the majority of new cases on a daily basis across Ontario. I want to impress upon you the importance of achieving the highest vaccination rate possible, especially in our cities and in the Greater Toronto Area. Of the 321 cases today, almost half are in Toronto, Peel, and York. This virus does not discriminate. If you are unvaccinated, you are at a much higher risk of contracting COVID-19. We together have weathered 3 waves of COVID-19, which has pushed our public health and health system capacity to its limits. But we have risen to the challenge. We beat back these waves by following basic public health measures and guidelines, including isolating at the first signs of symptoms of COVID-19, by getting tested, by wearing a mask in public spaces, by physically distancing, practicing good hand hygiene, as well as rolling up our sleeves to get vaccinated once it became time. And this remains the best method for a safe future for all of us. We have learned so much regarding this deadly virus, and I'm confident if we continue these measures, which allow us to keep our schools, our businesses, and our social settings open and safe. The coming months will require vigilance on behalf of all of us. COVID-19 is going to be with us for some time to come. But we have the measures and the infrastructure in place to manage outbreaks, and we have high volume capacity for testing, and we have the people on the ground to perform fast and effective case and contact management. And to keep the hard-fought progress we have made, we need those who have not come forward yet to get immunized. We all depend on each other, and I'm asking everyone to remain kind and caring and compassionate. There's still more work to be done, and I'm confident we can get through this together. And with that, I'll turn over to the media for any further questions.
Over to the operator for the first question.
Sure. Your first question comes from Allison Jones with the Canadian Press. Please go ahead.
Oh, hi, Dr. Moore. I'm wondering, you had warned in previous press conferences that we would see a rise in cases in September. It's now early August, and we're seeing a rise. Did this rise just come sooner than you expected, and could that be tied in any way to some of the Step 3 activities?
I'm sorry, the last piece was...
Is it tied in any way to some of the Step 3 activities that became allowed once we entered Step 3?
Yeah, this last rise in cases this week came immediately following a long weekend as well. I think whenever we let our guard down, take our masks off, and engage in social environments, we put ourselves at risk. And the hundreds of cases that were detected this week, I'm very confident were a result of some of the reopening, but also the social activity that takes place on a long weekend. And so it's not unexpected that we had a rise in cases over this week. And I do anticipate that it will fluctuate. When we have smaller numbers like this, the public health has tremendous capacity to do good source tracing and case and contact management. And our testing capacity is very good with quick turnaround times. So I hope our public health agencies across Ontario will be able to limit the spread. Although Delta is a humbling foe and can spread very quickly, we have a public health capacity now that might be able to limit its spread. And then I see our cases slowly going up throughout August, and then as we move indoors, the case counts will continue to rise. And we'll be watching the proportion of those individuals that need to be hospitalized and or need intensive care very, very closely. We do anticipate that there'll be different regions that are affected, given that Ontario has different immunization rates. Some communities are achieving very, very high protection and may be spared any significant rise in cases, whereas our large urban settings, I think, will have the highest burden of illness and will need to have the highest rates of immunization protection.
Follow-up?
Yes, just to follow up on something you said earlier, you mentioned we were getting close, about 3% away from meeting that 75% target to move beyond Step 3. When do you think we will reach the 2 remaining targets for moving beyond Step 3? And do the rising cases give you any pause for moving past Step 3?
Well, I'm watching the data on a daily basis together with government decision makers. It looks like we'll be able to hit those targets over the next week to 10 days. It all depends on how many Ontarians come forward. I think we're all watching that the trend is slowly decreasing. We're at around 50,000 people coming forward a day for first and second doses. I think as we head to September, many of the children 12 to 17 will be coming back for their second doses to have good immunity prepared for school. So that may keep our numbers strong, as well as colleges and university students will be returning into their settings, and many have adopted immunization policies for their settings, which I think will only encourage increased uptake by those populations. So I hope that our numbers of people vaccinated will increase over the coming weeks, as I think people have been putting it off in the summer doldrums, and would anticipate that the risk will go up in September, and I hope anticipate that risk by getting immunized with good protection heading into the fall. So I'm always hopeful that our numbers will continue to go up. As you know, our aspirational goal for Ontario is to move towards 85 to 90% of our population immunized, and I'm so thankful that some communities are actually achieving 89% today in Ontario. Waterloo is at 84.5%. It's just brilliant work that these communities are doing day in, day out to try to answer the questions of anyone that's hesitant, to try to respond to their concerns, to not be judgmental, to be offering the vaccine every single day in a pharmacy, in a primary care setting, or on a bus that's mobile, moving from venue to venue. Our local public health agencies are being very adaptive and very innovative to try to reach out to our communities and please take advantage of them. The vaccines are here. We used to have a restriction in supply. We've got ample supply of the mRNA vaccines, both Pfizer and Moderna, and now is the time. We need to have a steady increase in immunization, and I'm very, very hopeful that more and more Ontarians, as we get through the summer doldrums and anticipate this rise in risk in the fall, will come forward. Our local public health agencies are working so hard to make the immunization accessible, available, and answer the questions that any individuals may have. It would be wonderful if we could head towards 90% across Ontario.
Next question.
Your next question comes from Manessa Danabalan from CHCH News. Please go ahead.
Hi, thank you for taking my question. I was wondering, Quebec has announced last week that they're going to start vaccine passports, and they saw an uptick in vaccine appointments. What do you think about getting vaccine passports in Ontario?
I'm just so impressed by Ontarians coming forward. So, we're at 81.5% completely voluntary without the requirement for a passport or mandatory vaccination, and second doses are, 72%. Ontarians, I think, have realized the benefits of being immunized. It's a chance to get back to normal, a chance to socialize within your family and not be worried, a chance to go out to some venues and not be concerned, and potentially travel internationally. So we are making good and steady progress, and I'm thankful to all Ontarians and thankful to our health units that are reaching out to make the vaccine more accessible and available. It is working without mandates. I can understand, though, in certain healthcare settings where the vaccination rates may have been low for workers, that hospitals have stepped up and put in policies to protect their patients. That seems appropriate to me in those settings, and some universities are stepping up by saying they would like individuals to be immunized to come on campus. That makes sense to me from a public health vantage point to protect the campuses, because we know that age group has the highest rate now of disease and some of the lowest immunization rates. So I thank them for encouraging individuals to come forward, but as a province we are doing very, very well and keeping up with the national rate of immunization. I do think as we head into September our numbers will come back and will continue to accelerate beyond 81, 82%, and again celebrating 20 million doses being provided to Ontarians is just brilliant work by all of our partners.
Follow-up?
Is this something that the province might mandate for non-essential activities?
The government at present has not been reviewing any passport for internal purposes. We're certainly working with the federal government, who we would like our citizens to be able to travel internationally. And if the federal government's going to work with us on a vaccine passport for international travel, that seems very appropriate. And we're certainly encouraging them to work with the WHO to ensure that the National Advisory Committee immunization recommendation of interchangeability of vaccines, mixing of vaccines, is approved internationally to ensure our citizens are allowed to travel. I believe our vaccine strategy is par excellence. It's an internationally recognized achievement that Canada has achieved, and our strategy should be recognized by the WHO.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Dr. Moore. You've changed the metrics for how COVID is reported, or perhaps the government. I'm not sure whose initiative it was in terms of reporting people who are unvaccinated, partially vaccinated, fully vaccinated. In an op-ed, you're talking about the fact that COVID won't go away. You're making similar comments here. I'm wondering, are you trying to get the public to understand the sense that COVID is changing, and that if we do see a fourth wave in the fall, that it won't be the same as what we've experienced in waves 1, 2, and to a lesser degree 3?
Yeah, I think that's a very good point. I think we've learned a lot from this virus over the last year and a half, and we've built very good capacity. I think we know now basic public health measures of masking, hand hygiene, distancing do work, and that we have world-class testing capacity in Ontario if and when it's required for someone that's symptomatic. And now on top of it, we have a world-class immunization strategy that is achieving 80% plus first doses and 73% second doses. So that is a major change. And these vaccines, as I've said earlier, are protective. They do decrease your risk of being hospitalized. They decrease your risk of ending up in the intensive care unit. They decrease your risk of death. We are so fortunate to have been a world leader in this immunization strategy. Please take into consideration that only 30% of the global population has had access to first doses, and around 15% have had access to second doses. We are privileged. We are honored to be able to have had access to these vaccines, and I think it behooves everyone in Ontario to take advantage of them, to show the world that these vaccines work, they're effective, and they can allow us to get back to a new normal. We've achieved a lot, and I think we can achieve more, heading to 90%, to really reduce the risk of COVID to our vulnerable population across Ontario.
Follow-up?
I'm sure you're aware there's a lot of chatter about a potential federal election. Manitoba has already said that although schools have been used as polling places in the past, that they do not want schools used on voting day if and when we go to an election this fall. Minister Lecce said last week that he would rely on advice from you. So I'm wondering what your thoughts are on, given all the COVID protocols we have, is it safe to allow hundreds and in some cases thousands of people to enter schools as polling places if we do go to an election? Or is that something that you would recommend against, and that they find other places for people to cast their ballot?
Oh, a good question. I'm sorry, I really wasn't aware that there's an impending federal election. But if I was asked, I would agree with the minister. We have strict policies for people entering into schools. They have to be masked, they have to be screened, and appropriate protocols are in place. I think opening them up at whatever time of year it's going to be, to additional people coming into that venue may be a risk to the public. I would certainly review it and provide guidance to the minister. But at first glance, I would say I would agree with the minister.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. I just was taken a bit by surprise today on the breakdown on the breakthrough infections. So for today's number, it worked out to 19.5% of people had breakthrough infections were fully vaxxed. And I'm wondering, who are the people now that are getting the breakthroughs and just having a simple infection at home? And who are the ones that are going into hospital and needing ICU? Or do they tend to be older? I'm just looking for some level of detail on that.
A good question. On average, across Ontario, when you look at breakthrough infections, it's a very, very small percentage of overall immunized Ontarians. You have to remember now that we have over 10 million Ontarians that have taken advantage of first and second doses, and only a very small percentage of them, it's around 0.5% of them, have had a COVID infection on top of being vaccinated. And typically, those are older individuals that have become symptomatic and gotten tested as a result. And those that would be predisposed to being sort of a breakthrough infection from COVID-19, although fully immunized, so that's 2 doses plus 14 days, typically are older. They've been involved in a social contact or an outbreak setting where due to some immune issue, they have had ongoing symptoms. And if they end up being admitted to hospital, it's typically because they are an older population with a more brittle or frail immune system. That would be the typical story of a breakthrough infection on someone who has had 2 doses plus 14 days.
Okay, thank you for that. Perhaps you could elaborate a bit on when you say older. I don't know if you're meaning seniors, but I'll go on to the next question. Is are you sure it's a great idea to lift capacity limits at a time when, for example, in the last 2 weeks, the 7-day moving average is up it's about double what it was 2 weeks ago, and when we go to this 75% second vax level, that's when the capacity limits will lift. So you're still comfortable with that?
Yeah, I think it's a call to every Ontarian to come forward and get vaccinated. That is the main means how we can open up more safely and protect each other. We're all in this together when it comes to a virus that can spread so quickly. And the highest immunization rate we can achieve will allow us to have the safest reopening. And because it's Delta, which is a game changer, we also must have the basic public health measures of masking in public, plus good hand hygiene, plus distancing when you can. That combination should be able to protect us, but it won't stop this formidable foe of Delta, which wants to spread so quickly. It's going to be a combination of basic public health measures plus a high immunization rate. So that's why I come out here every week. It's a call to arms to those that are hesitant. You are the ones, those that are unvaccinated, are the ones that are getting the illness now. And you have a much higher risk, 8 times higher risk of getting the illness, as well as if you're over 60, a 15 times higher risk of getting admitted to the hospital. All of that is preventable by having a high rate of immunization in our population. I'll say it every day of the week if I have to. It's a call to arms for every Ontarian. That is the way we're going to reopen safely, but we will always need some basic public health measures. And your local public health agency, if they're finding outbreaks in certain settings, can also put in section orders or reopening of Ontario Act orders to try to limit social gatherings in some environments if they're finding they're a consistent source of outbreaks in a community. So there's always local flexibility to respond to the outbreaks or changing epidemiology in some settings. But provincially, it's our goal to keep us open, to keep our schools open, our colleges and universities open, and to allow our mental, physical, social, and economic well-being to get back.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Good afternoon, Doctor. I wanted to go back to something you said about healthcare facilities and post-secondary education, like universities mandating vaccines to different degrees and how that made sense to you. Wouldn't the arguments for post-secondary education also apply at least as strongly, if not more so, for public schools where so many of the children who attend school cannot be vaccinated? Should we not therefore be requiring that at least the children who can be vaccinated, and that certainly that frontline adult staff be vaccinated as well?
A very good question. So I'm very comfortable, having read the education plan and been able to consult on it, that from the child screening before they get on the bus, to being on the bus with a mask and a cohort in a designated seat, to arriving at school and staying in their cohort, physically distancing, having the teachers protected with masks and shields if needed, face shields, as well as having a robust testing strategy in schools, as well as having hand hygiene, and all the precautions that we put into the school setting. I feel very confident that it remains safe for our children, and the risk of COVID-19 in children is less, generally speaking, than adults in terms of illness and hospitalization and negative outcomes. Whereas in universities, much more social, living off campus, less ability to control their social environment, their activity levels, and in the class setting, much more difficult to control the basic infection prevention control practices that we've been so concentrating on within the school setting. So 2 different settings with different rules and a different approach. And I forgot to mention all the work that's been done on improving air quality in schools, ventilation, HEPA filters, etc. Whereas I do see the rapid propagation in that college, university age student to be a risk for rapid spread of Delta in particular if they don't have robust and high immunization rates, given that they are a population that hasn't taken advantage of the immunization strategy to date. So again, it's a call to arms to them, and it's not too late to get their first dose now and second dose 28 days later, and then you're building immunity within a week to 14 days against this virus. So please come forward, any college, university students, now is the time.
Follow up?
I mean, I take your point that children generally have a less severe course of illness with COVID, but they also don't live in hermetically sealed bubbles. They go home to their parents. They have extended families that they see, and hundreds of thousands of Ontarians over the age of 50 are still unvaccinated. And I'm wondering how concerned you are about spread in schools leading to secondary cases in a population where the outcomes could be more severe. And if I could just tack on a bit more here, is 300 people in an ICU, in the province's ICU beds, still the threshold for new public health measures to control the spread?
So I am concerned about propagation of virus. In my experience at a local public health agency level, and of having reviewed the data for Ontario, most of the infectious activity in those age groups doesn't occur in the school setting. It actually has occurred in the social setting where we take our masks down, we have interactions, close proximity, distancing isn't occurring, and masks aren't being worn. So it typically occurs in a home or a social setting where the virus is transmitted. All the more reason that parents of school-age children should be immunized. There's no question in my mind that we don't want parents to be able to give the virus to their children and or their children propagate it in any other social environment. But the school setting hasn't been a high risk of transmission in our experience in Ontario due to all of the great work that our school boards have done in partnership with their local public health agencies and following all the protocols that have been put in play. The metrics for which we would want to have broad-based further public health measures are being reviewed. The hospitalization rate and hospital capacity and intensive care capacity will be key metrics that we'll be monitoring. Again, it's anticipated that this won't be broad-based. Ottawa, for example, is almost reaching 85% of their adult population, 12 and over, having had of their first doses, and their second doses are catching up quickly. Other regions of the province are having very high rates of immunization. And so the intensive care utilization may be very regionally focused where we don't have high uptake of the immunization strategy. And we'll be able to provide care to those individuals by moving patients across the province like we did in the third wave. The public health measures to control and limit the spread, hence, will not necessarily have to be province-wide. They'll be focused by a local public health agency and or a regional level to control the spread of the virus. That's the way we're thinking that it's going to be going. We're modeling it. We're working all August by table-topping these exercises of spread with our local public health agency partners, with our hospital partners to try to prepare and anticipate what actions we'll have to take at a local, regional, and provincial level. But through our tabletop exercises and modeling at present, it really is about local control, regional limitation of spread, and using the entire health system capacity of Ontario to respond if and when it's necessary.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Dr. Moore. Thank you so much for taking our questions. I wanted to go back to the idea of the vaccine passport and just comparing to what Quebec talked about today. I guess I'm trying to understand, and I don't think you've really answered why Ontario is not doing this. Like, what's holding Ontario back from instituting a passport system? Is it like what's the concern over doing this, aside from kind of just issuing your call to arms and saying we don't need it, we have a high rate. With the majority of people now having received their first dose, why wouldn't Ontario do this?
So I think it's a government decision not to have mandatory immunization policies, and I think they'll review policies over time, and I don't think any door has been formally closed, but we are achieving the goals we wanted to achieve through our local public health agencies, partnering with pharmacies, primary care, and have a very robust world-class strategy. And as such, I don't think it's absolutely necessary right now. I do think we're going to see an acceleration in doses as we head into September. And I know people have concerns that it has quietened, but I'm very confident as we head to September, we'll have more and more people coming forward as they realize the risk is going to rise in September as we head indoors. And all of that will occur without a mandate, without a passport.
Follow-up?
Okay, thanks. And I was hoping you could expand on this, on a fourth wave. We're hearing about the possibility of a fourth wave or cases rising. Obviously, it's different now with vaccines in the picture. So can you just describe, like, what does a fourth wave look to you? And you sort of you cataloged this in your op-ed this week about, maybe the focus not being so much on cases, but hospitalizations and ICUs. So what does it look like to you? What are your concerns? Does it involve younger people? Is that what we're watching? What are you watching for as we view what a fourth wave might be?
Oh, thank you for that question. So we're now having a slow and steady rise in cases, absolutely expected for a virus that prefers low humidity and colder temperatures, and it will come back. And as we head indoors and the temperatures go down and we're closer faces, closed ventilation systems, the virus will tend to want to take off. Given the vast majority of our elderly individuals are protected, we anticipate that the admissions to hospital and the burden of illness that will require hospitalization will be in younger age groups. We saw that in wave 3, where it was a progressive increase in people under 60 that were actually requiring to come into hospital to get extra oxygen and or to be ventilated. And that is the age group where we anticipate the fourth rise in cases, the fourth wave will affect, and I'm calling on them day in, day out to come forward and get vaccinated, because every single admission to hospital is preventable. Every intubation and mechanical ventilation, to me, is preventable going forward if we can achieve a high rate of immunization. It would be a tragedy to me to have, I've heard the stories of people about to get intubated saying, I should have been vaccinated. We've heard that so many times in the news in the United States, and people begging to be immunized when it's too late. Now is the time to get immunized before we start seeing that rise in cases and that next rise or surge. It'll be difficult to say when the absolute takeoff will be of cases. I see a slow and steady rise heading into September and October as we move and socialize. And I do think that we'll again be able to suppress influenza activity if we all continue to adhere to masking in Ontario. It really helped us last year not to have any significant increase in cases in influenza, and having a robust immunization strategy that we're going to have available to all Ontarians in October, November. That combination of masking, COVID immunization, influenza immunization could give our health system a chance to recover and get back to the great work that they do day in and day out. And if we really work well together in Ontario, we can blunt this. We can decrease its impact. We can lessen morbidity and mortality and have less young people die as a result, because that is the threat of the unimmunized younger population that have any underlying chronic illness, diabetes, lung disease, heavy smoking. They are the ones that are at risk going forward if they haven't been immunized in the fall.
Last question.
Your final question comes from Colin DeMello with CTV. Please go ahead.
Hi, Dr. Moore. One of the things you've said is that Ontario has to learn to live with the virus. So I'm wondering if you can kind of, look a little bit beyond what the fourth wave is going to look like, and how do we learn to live with this virus, especially now when we still have masks and physical distancing and limits in gathering? What does that, final stage look like, living with the virus, and what level of cases are actually acceptable?
So, depending on what level of immunization we achieve, I'm hoping for aspirational goal of around 90% of Ontarians. Around 3 to 5% additional would have acquired the immunization or acquired the infection naturally and had natural immunity. Once you get around 95%, you'll just have regular low rates of illness, causing intermittent outbreaks in long-term care facilities, retirement homes, hospital settings, congregate settings, and a low rate of community infection, where we'll all be able to get back to our normal activities, and it shouldn't have a significant impact on our hospitals, our intensive care capacity, and we'll be able to handle the outbreaks in the congregate settings of long-term care. We're getting very good at testing strategies, isolation strategies, and profound, robust infection prevention and control in those settings. So those are going to have to stay with us for the vulnerable settings of high-risk retirement homes, long-term care, and any other congregate setting. That will be our normal, maintaining and learning from this last year and a half of what can slow down the virus. Otherwise, as children acquire this infection at a low level, they'll build natural immunity like any cold virus, and it'll become seasonal. And how long that takes could be several years. And the only wrench that could get thrown in, as I said, 70% of the globe has no vaccine, and that virus can still replicate and change its structure and threaten us with a new strain. And that's really the responsibility of the federal government to protect our borders, to have a good testing strategy for anyone returning, and to work well with the WHO to monitor for any new strains internationally, and then to put travel restrictions and surveillance testing in place to best protect us.
Follow-up?
Thank you. And on the borders, obviously we're seeing cases surge in the United States to, in some cases, unprecedented levels. How comfortable are you that the border with the United States has been relaxed and, travelers from the States can now once again enter Canada?
I was very happy that we were consulted by our federal governments. We were able to provide opinion on a safe reopening, and it was a partnership. We did want all travelers to be 2-dose immunized plus 14 days plus a test. That strategy, I think, is robust, should protect Ontarians, and anyone visiting must adhere to our rules regarding masking in public spaces, buses, trains, malls, etc. So that combination, I think, should protect us in partnership with the testing strategy that's already in place.
Thanks, everyone.